Good morning, everybody. I'm Dr. Sean Benham, and I'm joined with Michael today. He's joining us today, and I'm performing a hair restoration on him. So thanks so much for coming.
Thank you for having me. I feel really blessed to be able to get a doctor who's world-renowned and board-certified, and I'm just really lucky and very excited to have this done.
Well, we're very excited to do this procedure. So let's just do a quick recap about what we're going to do today. So one of the most important things is we're going to evaluate the hair under the microscope, and he has a finer hair but consistent and with one another. So we're going to be doing a FUE procedure, and let's just look at the top of the scalp right here. So he is class 7, so this is a significant degree of hair loss, right? So one of the most important things is that we're going to bridge the gap. That's really important, right? We're going to work on the frontal region for first day and bridge the gap so it looks natural, age appropriate, and frames the face nicely. Remember, hair restoration is not magic, and you should have very realistic expectations, especially when you have this much degree of hair loss, right? The goal is to bridge the gap, connect things, one side to another side, and give that nice, good illusion that there's good set of hair on top of the scalp. Perfect. Should we get started?
Please.
Awesome. Let's do it. We're gonna go to our procedure room now. So I'm going to be explaining how I make the design. Now I know because a lot of doctors are also watching, so I'm going to give a lot of tips of how I do it. And this is very, very important. So look down for me just a bit. So he has significantly wide mid-scalp. So I know he's going to lose all the way up to here, all the way up to here. This is a huge area. So we have to imagine that he's going to at one point lose all of this. And we have to design a hairline that will match and frame his face. Now, one of the issues I see all the time is that people try to lower the hairline to when he was 18 years old. Well, that's a mistake. You will run out of grafts, not have enough. So we have to design it in such a way that it's natural, age appropriate, and frames the face nicely. So do you mind looking at me right here? Okay. And we're going to do some measurements, and this is another tip, right? So somebody with a class 7, right, you want to begin a hairline from level of eyebrow, in this case, about 10 centimeters. And this is how his hairline was when he was younger anyways. It matches his other hairs that he currently has. And then the corners, right, you take the lateral side of the eye and go all the way up, and it ends up actually here. And the reason I actually put it down here is because he's going to lose all this. So when he loses more, you want your hairline to stand out and still be natural. So then we're going to measure another one right here. Now, one of the most important things to note is that hair transplant and hairlines in general, right? Hairs do not grow on straight line. In nature, nothing is symmetric, nothing grows on straight lines. You have to create this natural, what appears in nature, and that's what I will be doing, okay? So, but the first line needs to be more symmetric, and this is like a painting. This is an art. And you can see in some regions we're above his current hairline, and that is okay. Again, we can't lose the focus that naturalness is really, really, really key. I'm going to do my measurements one more time. And this is the first line. And the first line is symmetric, is on a straight line. We're going to be covering this region within that area, because once you cover that, the hair, you could comb it left to the right, to the left, backwards, whatever you wish and whatever you like. And in the future you could always lower it, but if you start too low from here, you're going to require a tremendous amount of grafts and you can't go back. The zigzag pattern breaks up any straight lines. And I see a lot of hair restorations that they don't do this zigzag pattern. This is the most natural way. I've done this over 4,500 times. It works really nicely. This center area, I love the diamond shaped pattern. It really frames the face nicely. It gives the illusion that it's a low hairline. At the same time, it's very natural and frames the face nicely. So again, you have to embrace the artistry of this. right? That is very important. And again, the left side and the right side should not match, right? Because in nature, nothing is symmetric, right? If they match, it doesn't appear natural. We just want it to be on very similar planes, and that is actually very important. And once the new hair grows, everything in front of it actually blends in very, very nicely, and that's key. And sometimes you could see the asymmetry easier and better on pictures. Please look down. You see that it's the size on the left and the right is almost identical. Not purely identical, but on a very similar plane. We're going to start from here, right? Build a nice hairline and just thicken up the center area, which is the most important area. And please take your ear and put it to your shoulder. So and then in the future, we're going to basically work on the mid scalp and the crown. And again, when you have this significant amount of hair loss, you have to build the sides as well, which we will be doing. And look, ultimately, right, for Michael, we're going to be also probably using the beard hair to also add some more density, just because of the degree of hair loss. Now, please turn around and look at the wall right behind you. Perfect, excellent. Now, this is the donor region. This is the area that we're going to extract the grafts. Now, hint, important things, right? This is a tip, right? This region, we know he's going to lose the hair. So I'm going to extract the grafts below that region. And that's actually very, very important, right? We're going to start from here, right? Because below that is slightly thinner. I don't want to go there. Okay, perfect. Now, this is really important. You have to approach everything as an art. Extracting the grafts from the back of the scalp, right? You cannot just extract on a straight line. It has to be in a zigzag pattern as well. Because nothing grows or is on straight line in nature. Right? So by extracting in a zigzag pattern, right, does not create any lines. Because when it comes to FUE, this is not a scarless procedure. You get very tiny little scars, even though we use a 0.8 millimeter punch. So by extracting in a zigzag pattern, just like the hairline that is zigzag, it looks natural. It does not give the idea that this is made or designed by a person as opposed to nature. And that is very important. Now, big tip. The person who does the extraction must do the shaving. Because I know exactly what length of hair I want. And I have a 5.0 magnification loops that I'm wearing, and then I'm going to shave it down. Perfect. So this length is what I want, is perfect. You could see the individual grafts, and sometimes everybody has a slight curve to the hair. I'm able to visually see that curve. And that's important, especially when using a 0.8 millimeter punch. It's a really small punch. And sometimes I have to curve every time I actually punch. Okay, so I use the number one to kind of just taper it, and this is important. You know, my patients really do appreciate the fact that I take this extra minute. And, you know, for all those surgeons and doctors out there, I do recommend spending about a week with a professional hairstylist, which I did, and helps out. Perfect. We do not need to color in this case. There are few things I just want to talk about, right? So I look at all the length of all the hair I want to extract. I'm going to make sure it's all what I want. Second, if there are any scars, right, you let the person know, and that's important. right? Because a lot of people don't know. Third, we talk about that zigzag pattern. This is the most important thing. If you extract graphs from on a straight line, it'll be obvious, even if it's a very small punch. So you have to do a zigzag pattern, so it's not obvious. It looks natural. There are two nerves that run in the back. There's a nerve that runs here, and there's a nerve that runs here, and we're going to be numbing both of it, and everything will get numbed up, and that will be done easily. Perfect. So we're going to clean up, and you can see I tapered everything with the number 1. So we're going to clean up and we're going to get started. Excellent, excellent. So basically this is the area that we're going to be working on. I'm going to have you turn around all the way here up to that region. I'm very excited. Let's do it. We basically count every 1 graph, 2 graph, 3 graphs. So we know exactly how many 1s, 2s, and 3s we're getting. And every technician has his or her chart. So in this case, we have 239 3s or 4s. We grouped them together. 352 2s and only 74 1s. We need some 1s for the hairline. All the graphs are placed in special metal cups that have basically growth factors in them. The 2s and 3s are separated. Everything is timed. And a tip, this is very important. All the graphs from the first 1 hour are placed in the refrigerator at 4 degrees Celsius. All these graphs are maintained at 4 degrees Celsius throughout the whole procedure. I only extract for a certain limited amount of time in order to maximize graph survivability. An important factor in the procedure room is that we have background music, and that's important. It's very calm and relaxing, puts out of day. Patients like it a lot. So now I have finished extracting 2 hours, and I stop at 2 hours, right? And now Michael's eating. So how was the extraction part? Was it good?
Not bad at all. A lot like almost no pain, practically no pain. I think I slept through most of it, so it was pretty relaxing.
That Valium helps out, and now he's eating, and we have a bunch of restaurants around, but now we're kind of in this semi-quarantine, so only Carl's Jr. is open, but they have good food. So let's take a look at the number of graphs that we got. Okay, so important things is that I only punch for 2 hours period, because according to my clinical studies as well as my patients retrospectively, once you punch for 2 hours, your graph survivability is 90 to 95%. So within the first 2 hours, right, we got 2,533 graphs. 969 of them were 3s, 1,260 of them were 2s, 304 were singles, which we're going to use at the hairline. But this is just part of the story, because the important thing, you need to count the amount of hairs that you actually get. And there are also some 4s within the 3s, but we just couple them all together. So from the 2s, right, you get 2,520 hairs, right? Within the 3s, you get 2,907 hairs. So you add everything up, and you got, right, 5,731 hairs. So 5,731 amount of hairs. Now if you divide that by the number of grafts, right, so 2,533, you get 2.26 hairs per graft. Average is about, strip is 1.8 hairs per graft, and average FU is about 2 hairs per graft. So why is this so important? That is, out of every 1,000 grafts, you get 2,200 hairs. And that's how I create density, because of high numbers of 3s and 2s, very minimal 1s. Right? And this is very important. So out of 2,500 hair grafts, you got 5,700 hairs. And that is the key factor. Perfect. Awesome. So next, he's going to be finishing eating, and we're going to make the sides and place the graphs back in. Wonderful. I have made all the 2s and 3s, then I've made all the singles and all the scattered singles. So this is how it looks natural. Right, so people say, oh, how does it look natural? What's the formula to making it look natural, right? I want to make sure mine looks natural. Well, because the random singles placed in front, behind that 2 rows of tight singles, and behind that 2s, behind that 3s. This is how it looks natural. And look, it takes 2 hours to create the design and the pattern. So the doctor who's doing it must make sure to spend enough time to make sure the design is there. Excellent. Now I'm going to go ahead and trim it, and then we get started. Oh, yeah, please put your head back. Good, yeah. The more you apply pressure, actually the better it is. Okay, so right now let's explain it. So thank you so much. I know. So we have made all the sides, and just want to reiterate, the reason it looks natural is because you have all the scattered ones in the front, and then 2 rows of tight ones, and then 2s behind it and 3s behind that, and these are all the slits. And now we're going to start placing. If you actually take a look from the front, and as well as measuring it from nose level, you see that 50% on this side, 50% on the left side and the right side, so it's on the same plane. It's framing his face, and all the angulations, again, the angle of the hairs over here go in a downward direction, they change and go upwards, and on this side they go down again. All these are very important, and that's why it took 2 hours to make the sides. Perfect. Excellent. So one of the most important things when making sides, right, is that the patient must be sitting in a position that the head is facing the forward direction. Because this way, I'm going to set the angulation of the hair, that means the degree that it comes off of the skin, based on how he is looking forward. A lot of times I see that the sides are made with patients completely lying back, and unfortunately during that, when someone is lying fully back, the hair is made really flat to the skin and does not look good when it goes out. So now I see exactly, he's sitting this way. I'm going to have him tuck his chest to his chest. I'm going to make all the hairs at a 70-degree angle. This is very important. I'm going to repeat it again. So a patient is sitting on his back, right? The angles are made very flat to the skin, and the hair goes straight forward and does not give the illusion. But the angles now have to be made at a 70-degree angle, right? So, being in this position helps out tremendously. So as I'm making this size, I'm counting. I'm following exact the angle directions. Congratulations! We are done with this wonderful and beautiful day. 2,500 grams, 5,700 hairs at a hairline. I love it. They have settled really nicely. Just gonna go through all the quick post stuff and gonna send you home. So
thank you very much.
Perfect. So we're gonna go next door and do it. But I have to say, probably the best I've ever done in a 2 hour period, getting 2,500 grams. That means 200 grams per hour. I'm just not talking about weak grafts. This is 3s, good quality, very good, excellent. Okay, yeah. Doxycycline twice a day. The first time you take it, right, so just make sure with food, but not milk. Okay. 1 time twice a day. This is Tylenol and Advil. So, do you have much pain?
I mean, right now, no, but you put a lot of Novocaine. I'm imagining later when
as soon as you get home, you take 2 of each. Okay. Okay, and before you go to bed, 2 of each. If it hurts a lot, you take 1 Tramadol.
Okay.
Okay. Perfect. So the most important thing is that you spray the top of your scalp every 10 minutes. You get very close and you give it a good spray.
Every 10 minutes?
Every 10 minutes until you go to bed. And then you still have a 45-degree angle with a neck pillow, head slightly elevated. Okay, and you get up at 2 and 4 in the morning and you spray the heck out of it.
Okay.
Okay, so this way, this is a special solution. You have nutrients, elements. It's good for your grafts, okay? This you don't do anything with till tomorrow. These are tape you already have. And then these are pillowcases and hats. So the pillowcases is for your pillow, because you will have some oozing tonight, and that is okay. Okay. Right? And this is nice clean hat. Not really, that's about it.
Okay, and then tomorrow do I come in for?
Yes.
Okay.
At after 2:30.
After 2:30.
After 2:30.
Okay. Perfect.
Oh, we have you just sit down for 1 minute. So if you just take a look at it, you got one last time. Perfect. I love it. Excellent. Look down for me. Perfect. Perfect. Awesome. So you spray really. Sorry, does that hurt?
No, no.
Good. You sprayed really, really well.